how do you see thriving as a brain thing, since we're here to celebrate our 25th anniversary of brain health?
The brain is our most important organ. We have spent far too much time deprioritizing it, not talking to patients, consumers about it, and we are paying a very heavy price. I mean, as you know, we are spending $4.1 trillion in our healthcare system, 17% of our GDP, up from 5% in the 1960s. And look at the results. Mental health, brain health, diabetes, obesity, all skyrocketing. So clearly it is unsustainable.
Bringing brain health, regardless to what you're dealing with, is really important for people to put self-care in front of that.
People go to have their annual physical, but what happens? What do they do every day?
We think about, I'm just going to do whatever I want, and then doctor, fix me.
I'm obsessed with brain health. I had my brain MRI a year ago. I've had my genetic tests, but what am I doing every day is going to impact my brain health. How I'm sleeping, how I'm dealing with stress, what I'm eating.
Well, you're singing my song, Arianna. Truly. What's exciting is our brain health index that we've developed based on the last 2 decades actually has those factors in it. Sleep is part of it, compassion, connectedness to people and purpose is one of the biggest brain health drivers.
Now you see it everywhere. It's in the zeitgeist. And it's really exciting to see finally the world waking up to the importance of daily behaviors. We call daily behaviors the miracle drug. And often it goes hand in hand with life-saving drugs.
So how do we get self-agency into people thinking about it? And that's what you were really trying to speak to, is health is what happens in between doctor visits. It would be like not brushing your teeth until right when you visited the dentist, or exercising when you went to have your physical to try to lose weight when you're going to get weighed. So you start dieting the week before. What is it that we can do to inspire people to take agency about their brain health?
Well, the first thing, Sandy, is to break it down into micro steps. People present behavior change as New Year resolutions, and it's too big. We need to break it down into tiny little steps. Can you start your day taking 60 seconds to focus on your intention for the day, on what you are grateful for before you go to your phone? Can you start your day with a glass of water before you get your cup of coffee? As you know, sleep is foundational for the brain. Now, the science of sleep has finally become mainstream. That's a huge shift in culture from I'll sleep when I'm dead, or you snooze, you lose.
One of the studies we did in sleep looked at people with mild stage Alzheimer's, people with mild cognitive impairment, and people that were healthy controls. And it was a sleep study where we measured brain energy metabolism. And when the individuals with mild cognitive impairment, through a dental device, got better sleep, their memory went to the level of normals, and their brain energy metabolism went to the normal range. The cumulative effect of doing things is really transformative.